Hello everyone and welcome to week 5. This week we will look at the endocrine system. So we'll start off with the PowerPoint 5A, which covers chapters 34 to 37. So chapter 34 starts with the introduction to the endocrine system and examining how the nervous and endocrine systems work together. There is a descriptive slide and slide 3 with all of the specialized cells that produce hormones, and we'll go through many of those throughout the chapters. It's important that you know the basic characteristics of all hormones. This is so you can know when something is different. So pay attention to those main facts that are included early in the chapter, including that there are very small amounts of them produced. They're secreted directly into the bloodstream. These facts are very important to understand how the endocrine system works and how the hormones work all together in similar and different ways. The next slide, on slide 5, talks about the endocrine system and shows in a very clear way, although it is a little bit busy, how the hormones are travel from where they are originally produced and go out to our organ systems. Again, pretty important that you spend some time familiarizing yourself, at least to know all of the different areas in our body that are impacted by hormones. It's important to spend some time getting to know the hypothalamus. This is the master gland of the neuroendocrine system and is also the main area that growth hormone is released, and is also the main production for ADH and oxytocin. There are networks that connect the hypothalamus to the pituitary gland. It's important that you are able to follow those and know that the neurological network delivers ADH and oxytocin to the posterior pituitary to be stored. So pay attention to those slides. It may be important to draw some pictures to help yourself remember and to make sense of all of that. Chapter 35 covers the hypothalamic and pituitary agents. This flows really smoothly coming from chapter 34, so if you have time to read these chapters together, it might really help with your comprehension, and starts to talk about the different drugs that affect the hypothalamic hormones, which is important for you to know. Again, paying attention to the types of drugs, but none of the specific drug names. Also taking specific attention to the nursing considerations with drugs affecting the hypothalamic hormones, and thinking about some things that you should be monitoring for patients that are newly taking these medications. As you continue on in the chapter, you should become familiar with what acromegaly is and why a growth hormone antagonist would be the chosen treatment for that. And the pharmacokinetics varies depending on which type of growth hormone antagonist is used. So don't focus too much on that, but make sure that you understand what acromegaly is and why growth hormone antagonist would be the appropriate treatment. Chapter 35 ends off discussing drugs affecting the posterior pituitary hormones. These are less commonly used and we won't spend a lot of time on them, but it's important to think about the pharmacokinetics and how they function and why they may not be appropriate for use in pregnancy, and where they are absorbed and metabolized. So pay attention to that and think about why that would be important for any drugs affecting the posterior pituitary hormones. Chapter 36 discusses adrenocortical agents, which are widely used to suppress the immune system, and they're used for short-term use to relieve inflammation during acute stages of illness. They do not cure any long-time inflammatory disorders. It is important that you learn the different types of corticosteroids. So slide 62 identifies androgens, glucocorticoids and mineral corticoids. So take some time to take a flashcard or put some of those terms on your study guide so you're familiar with them. It's also important in this chapter to know the causes of adrenal insufficiency and the main actions of the adrenocortical hormones. By understanding that baseline, you will be able to more easily remember what is occurring during adrenal crisis and some signs and the recommended treatment for that. Chapter 37 will go into thyroid and parathyroid agents, and they start off by identifying the actions of the thyroid gland. This is pretty important, so take some time to familiarize yourself. The thyroid controls many of the hormone levels, and it's important that you consider this when administering medications. So you should know the function of the thyroid hormones as well, and the types of thyroid dysfunction, which you've probably heard a lot about. They are commonly discussed in the media or suspected with someone who is overweight or underweight. So it's important to understand the pathophysiology of thyroid dysfunction and what is true and what is not true. When you get to the section looking at antithyroid agents, make sure you pay attention to slide 104 that compares the prototype summary of strong iodine products to methimazole. And I think that you'll see that the onset and the peak, which obviously are affect your half-life, are very, very different. One, the peak being 10 to 15 days and the other being 30 to 60 minutes. So this is an example where understanding how your drug works and the timeline of your drug and how it works is important for considering where your patient is at and what could be going on with your patient. As you begin reading about parathyroid dysfunction and hypoparathyroidism and hyperparathyroidism, it is important to consider that your parathyroid glands are impacting your calcium in the body. And as we know, calcium and sodium and potassium are some of the main electrolytes that are controlled within our bodies. For patient education and teaching, it's very important that you know the difference between anti-hypocalcemic agents and anti-hypercalcemic agents. So pay attention to the nursing considerations and safety within these drugs and focus on that more than the pharmacokinetics for all of the different agents within this class. As we transition into PowerPoint 5B, which covers chapters 38, 39, and 41, we begin with agents to control blood glucose levels. As you know, glucose regulation is a topic that now is really covering across all age groups and impacts basically every field of nursing. So having a strong understanding of glucose regulation, the pancreas, the endocrine glands is very important. After reading this chapter, you should know the makeup of the pancreas, and you should know the role of insulin and glucagon within your body and be able to answer questions on it. You should also have a good understanding of diabetes mellitus and disorders that are associated with diabetes, as well as be able to differentiate between type 1 and type 2 diabetes. Insulin is a very powerful and very important medication for many of our patients across the age range, but it's very, very important that you understand the monitoring indications for insulin and all of the risks, as well as the peak onset and duration based on the preparation of insulin. So take your time, do a lot of reading on this subject, because insulin is a medication that you should leave pathopharmacology with a very strong understanding of. Chapter 9 is the introduction to the reproductive system, and we'll glass through most of this chapter. Things that you need to pay attention to are the hormones that are produced in the ovaries, knowing about estrogen and progesterone and the function of the hypothalamus with relation to that. In the male system, you should be familiar with the effects of testosterone on the body. The rest of the chapter, I think that you'll mostly cover. You've covered it in anatomy and physiology, and the female cycle you will cover in women and children. So just focus on the main hormones for that chapter. Chapter 41 looks at drugs affecting the male reproductive system exclusively, and you can breeze through most of this chapter, but make sure that you pay attention to the nursing teaching indications for androgens mostly, and the safety. That's the main thing that I would like for you to take away from this chapter. So don't spend too much time on it, but you should know the major nursing safety considerations. In week 5, you do have a virtual simulation, Juan Carlos, looking at glucose control, so make sure you read your chapters before going on to the virtual simulation, and remember to submit your reflection into Moodle or Noodle after completing that. In week 5, you also have a discussion board with an option of 2 questions. Both of these questions challenge you to go back through your text and your PowerPoint slides to really examine the pathophysiology. The first question looks at the endocrine system and the hypothalamic pituitary axis. And the second question looks at DI and a particular intervention for that. So regardless of whichever question you answer, I encourage you to post responses to students who have answered the other questions, so you really challenge your knowledge and you spend time reading their answers, because in the end it will really help you in preparing for your final exam. Keep up the good work. We're now in week 5 and we are on the second half of this accelerated 8-week course. So remember, this is not a cumulative course. I'm sure that you were really glad that you took the time to have a study guide prepared for your midterm exam. And I challenge you to do the same thing for all of our chapters in preparation for our final. So take your time, set apart that 20 to 30 hours per week for the course, and get organized and enjoy learning the material. This is your baseline for nursing knowledge, and I hope that you're finding it really helpful and valuable.